Okay, here we go. We're going live. We're going live. Well, we got to put our little screen up here. There we go. Okay. Cool. Amazing.
Uh-oh.
All right,
Ooh.
here's us.
Okay, are we
Yay.
live?
What? You don't like that one? Yeah, we're live. We're live now.
No,
Okay.
no,
All right, here.
no, just checking that we're live. Um, and then I'm gonna
You never know
go,
what's going to happen.
don't go live. We're
Well, I
back.
already went live.
We're
We're
back.
back. We're back. We took a week off. We've been gone for 2 weeks. So many things have happened. Everything and nothing. Cigna and Humana are emerging.
Oh my
Companies
God.
are going out of business. People are dying. I don't know. Everything's going on. Everything and nothing. What happened, Lisa? What happened the past couple weeks? What happened?
Oh
You
my
always know.
God. It's been a really intense couple of weeks here. I mean, first of all, I'm of the mind that like the weeks between Thanksgiving and Christmas should just be a write-off, right? You're just like, that's when you start denying. So you're just like, yeah, let's catch up. Let's catch up after the holidays. Like January slash never slash the bottom of my inbox, which is already a black hole. So we're in the zone of no return right now. And in fact, it has been a really rough couple of weeks here for health tech. Kat is excited. She's waiting for all of the companies to fall apart so she can
Listen,
profit
I told you guys.
victoriously.
I told you. I told you. I've been preparing since 2013 for the next recession. So
2013, preparing for the
I feel like
recession.
we might be here. I don't know. Like I'm ready for it. I don't know. We have to ask.
She
Yeah,
just
there's
went
several
deer
of our
hunting.
guests.
You went deer hunting, so
Oh
you have
yeah.
some more deer stock. You're good to go. You're ready.
Listen, you guys, I'm totally ready. My dad also he distills his own pear jack, which may or may not be illegal in certain states. But listen, I know how to do everything. So I'm ready. I'm ready for the long cold winter, as discussed. But yeah, there was a bunch of layoffs, right? There was not necessarily all last week, but Health Catalyst had a big old layoff. We saw
Hmm.
Health Gorilla had a 30% layoff. NextGen had a big old layoff. So like,
Hmm.
listen, things are happening, which is not like we shouldn't laugh about it, right? Like people losing their jobs, and
I'm not.
unfortunately,
I'm
it's
not. I'm
usually.
not laughing about it. I'm
I mean,
really sad for all the people who are working there.
well,
Like
yeah, yeah. I'm just saying the
the
long cold winter. I
individuals
feel
who
like
are
not
working
everyone knows how
there.
to make their own pear jack.
Right. No, I mean I'm
Yeah.
going to be heading to Georgia, to the northern suburbs of Atlanta. When
Are we
when
ready?
the long cold winter comes, I'm just heading right to your house. But I think yeah, again, like this is how I feel about it, right? You know that I worked at a very bad company in the past who did really bad things, and also had a rise and a fall VC funded. The VC funding dries up at some point, and here's what I would say is like it really sucks for the individuals, especially the more junior individuals who join these companies. If anyone is thinking of joining a venture funded startup in the health tech space, drop me a line, because what I'll tell you is you need to know how to negotiate, and you need to understand that those equity dollars, the options, they're worth just about as much as the invisible paper that they're printed on. And you really need to very carefully understand what you're getting yourself into. The promise is very, very far away. And if you're joining a startup or company between the D and the E round or whatever, you are
Yeah.
as diluted as it comes. Don't believe the stories. You can work somewhere because you want to work there and you like what they're doing, but like make sure that your compensation is heavy on cash, because that's what matters in that situation. You will not walk away with a new house, a new car, a new life as a junior employee
Well,
joining between a D and E round. There's no way.
I agree with that. And before I rant more on that, I just want to say my new uncle, Richie Patel, who's the mayor
Aw,
of Warsaw, he says there is no recession. This is from our new moderator, Melissa Danino, which is amazing. We actually have someone like managing shit for us, sort of.
that's so good.
She's exceptional. She's great. He says it's just a correction in the digital health bubble. I mean,
Well,
Uncle
I
Richie.
agree with you. I agree with you. Kat is obviously on the doomer side. Kat is a
I am
doomer.
ready.
She wants the economy to collapse. It's her
Yeah.
whole
I mean, I
goal.
don't want it to. I just feel like I've been ready for it for a long time and I'm waiting. But no, back to but yeah, so okay, so I this is like the Dear Mighty Eagle segment, Lisa, where we tell people things. So you're right. Like what's really super sad about these layoffs is it's usually people who were told that they were going to get 12 stock options and those were going to be worth
Right.
$1.2 million if the
Right.
company became a unicorn. Like there's all this fake math and it really sucks. And I've been fortunate. I feel like I've had, and this is a bad thing too, right? Like I've had people who didn't want to get my hopes up. And so I didn't totally understand. But then on the other side, you have people who are just like using it as a recruiting tool and it's fake money and it's like all made up bullshit. So it is really sad. But I will tell you, much like Lisa said, if you're joining a company and they're raising an E round in health tech, um,
Get some cash comp. Get some cash comp. Do things you
cash
want to
comp,
do.
cash
It's
comp,
all good. Cash comp, cash comp.
go
We
cash
have,
comp, go
have
big.
I would say
What?
you have two let's call them nature enthusiasts in the comments here who are asking first for hunting pics and number two inviting you to move to Montana finally. So I just
Oh my gosh,
wanted to call
is
that
that
out.
Ben? Oh my gosh, yeah, I'll move
Our
there.
friend Jim Hogue and Ben Terrell are both inviting you out into the west. I think in Texas you do that. They're hunting the wild the boars, the wild boars, the super
Oh,
swine, which is
listen,
a whole thing.
I
So
okay,
I mean,
I got it. I don't want to like give too much away here, but I got an exclusive invite to a wild boar hunt in
oh
Texas.
god,
But it wasn't
oh
from
my
Jim
god.
Hogue. Jim Hogue has not
Okay,
invited me. He hasn't invited me.
okay.
I don't know. I don't know what's gonna happen, but I'm ready. And listen, I love both those guys. Jim Hogue is my BFF, as is Ben from Montana. So and Uncle Richie, but he's my uncle, so it's a little bit different.
Uh,
Anyway, so
Ritesh says DEF cash comp is what he says in the comments here. So
oh yeah,
DEF
yeah. You know,
cash comp, cash
honestly,
comp,
even
cash comp.
C, but yeah, it's so sad. So dear young people going into digital health or old
Yeah,
people, it doesn't actually matter. If a
whoever you
company is
are.
offering you most of your cash comp in stock options, just like do your diligence. I don't know. Like that's
Don't
sad. Also, if you
don't do
get
your
riffed,
diligence.
yeah, don't do it. If
Yeah.
you get riffed, if you're in one of these layoffs and you have all these shit ton options and you have to
Give me.
exercise them within 30 days or
Mm-mm,
90 days,
mm-mm,
really
mm-mm,
think about if
mm-mm.
you should do that. Don't
Mm,
just do it. It costs you
yeah.
money and it might be worth $0. So,
It
you know,
costs you
just
money and
really
there's
give it
also
wise.
tax implications which suck and it's really hard to
Ah,
understand. And so really just like what a company should do in this case if they're like, hey, you know what, we have to do layoffs. It is what it is. That's how life goes. The ethical and right thing to do is to find a way to give people their stock and make it so that it hurts them less on exercising and it hurts them less on the tax side. And so that's a high bar, but that's the one way that you can really make sure you're taking care of people as much as you can, even if you have to do a riff. Like, don't be jerks about it. Help them out. Dear all companies considering this option, please
yes.
ask
Yes.
me how I
Yes.
know. Ask me how I know.
Ask. No
Ah,
kidding. Okay, hey, what do you think of the Cigna Humana merger news? What do you think? What do you think about that? I don't know
yikes.
how that's
I
gonna work.
mean,
Didn't Humana get
mm,
antitrusted like 4 times or something? How's that gonna
yeah.
work?
And Cigna, no offense, Cigna friends, but they're getting some really, really bad press around their very aggressive use of prior authorization, let's call it, and using it to deny care and things like that. It's obviously that's part of all health insurance game. And by the way, Shruti can give us a whole schooling on that in a few minutes here. But I
Oh
do
yeah, we
think
can
that
ask Shruti.
they've had some really, really bad press. And so not only that, I think in terms of antitrust, obviously I'm not an expert in this, of course, totally talking out of my you know what, but I guess I just think that it doesn't seem very likely to pass through the antitrust gauntlet.
Yeah,
I
I
could be
mean, I
wrong.
don't really know how the government works, but it seems like if they stopped it many times before, or not necessarily this one, obviously, but like if they stopped Humana many times before, I don't know. I was reading some article because I was trying to sound as smart as you on this stuff, Lisa, and it was like something about their Medicare Advantage business, blah, 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 PBM, something, something. But yeah, I don't know, y'all, but I always think big insurer consolidation is interesting because it gets us a little bit into a weird spot, but oh, the
Yeah.
other thing, speaking of like bad press and bullshit, I was
Hmm.
thinking about that. The hot sheets, Mr. H, his talk.
Hmm. Hmm.
Still,
Hmm.
still the best news outlet on the
Still
internet
the
for digital
best.
health, despite that, as you noted, 1998 user interface. Didn't you read
Really good.
something that was like companies will be spending top dollar on trade show booths and whining and dining clients, even as they're burning and like crashing into the ground? I feel like it's
Yeah.
especially
Yeah.
a thing right now that big booths and rah rah do not mean uh, big money, big success. So
It really
tell you what.
doesn't. And the problem, of course, you have to buy those things way in advance and you're stuck with this massive booth and you're like, well, we got to use it. And then you're burning a gazillion dollars a day. It really sucks. It's hard for startups out there right now. Got to
Business
consolidate, got to
is
take that down
hard.
round. Take the down round.
Yeah. Business is hard. What else happened? I went to Poland.
You went to Poland. That was exciting.
I went to Poland. It was
for
kind
like
of a
4
fast trip.
days.
Yeah, no, it was like I was there. I was on the ground for 2.5 days. So not sure if I would do
Very
that
short.
same itinerary again. It wasn't the best for my my mental well being, but it was really cool. Listen, I don't do business outside of the U.S., so it was really cool to go and like think about and hear about a lot of people talking about how like, hey, your system actually doesn't suck as bad as ours. This is a lot of very international, lots of people there. So we were talking about how, at least in the US, you can kind of pay for access, and in some markets you just can't.
Yeah.
Like you just can't even get an appointment. So, um, made me feel great about America, which I technically always feel great about, but I was a little bit more grateful than usual.
Well, it reminds me, of course, so in September, I was part of this workshop thing at Harvard with the German government, with the arm of the German government that's doing the digitalization there. And so they've had a number of like really false starts, but they do have a major benefit of that they do have, for lack of a better term, command and control over the healthcare system. It does have a bunch of independent providers, and they are independent providers. They are like self-employed essentially, but there's a lot of regulation and structure around it, including like where a primary care doctor can set up shop. Like they get like a certain area more or less, but it works for them for the most part. But digitalization's been really, really tough. They tried this like really messed up thing with these like physical identity cards connected to the pharmacies, and it like immediately got hacked. It was like a total disaster and didn't work. But now they're like really taking another go at it, and they have people who actually understand what they're doing, and they're on their way, right? They're doing like ERX is now pretty much like on its way to being fully rolled out. Like they're doing all this stuff in a pretty quick clip. And so I'm watching to see what happens there, but they definitely have interoperability and exchange on their minds, and they're planning on rolling it out in the next couple of years fully across the healthcare system. So it's happening there. The money is a lot different, of course, which is a feature, not a bug. I know you don't like that, but it's a feature, not a bug. Less money floating around, frothing around in the healthcare system. It's good.
Yeah, I mean, you told like as everybody knows, Lisa's my primary source of news and on all things. So yeah, it was interesting. So Ritesh, who's Uncle Richie, and that's like an inside joke that maybe one day we'll have to talk about, but I don't know. I think it's too long of a story. But there, he was talking to us about some of the pricing differences for other conferences, right? U.S. conferences coming to Europe, and how they're just like they just don't spend like we do. So
uh
and
thousands
then
of
you were like,
dollars
"Yeah, Kat,
thousands of
why are you
dollars
dumb?" And I was like, because I only think about the United States of America. So, but you schooled me on that. So that makes
Yeah.
sense. But yeah, I did speak. I will say about the Germans though. I spoke with a guy on a panel about gamification, which I'm obviously an expert in, and his name was Stefan Schwartz, and he was in charge of innovation at a German payer. And what he and all of the panelists were saying is like, if you can get through Germany, like you're good. Like they are the worst slash hardest ever to get through from a regulatory perspective. So, Lisa, I'm glad that you chose to marry a
Yeah,
German. I feel like you passed the highest bar right there.
totally.
Great work.
Totally.
And yes, I was invited to teach a course at the Kosminski University to a bunch of entrepreneurs. I may or may not be saying that correctly. I don't know. I had a lot of anxiety about pronouncing everybody's names. So, yep.
We have a really we have a great comment from a friend of the pod, Anthony Leone is curious to see how staffed the booths will be at Vive,
Oh, I don't know.
given the market conditions. That's going to be that's coming up in February, so interesting time. We'll see also what the vibe is at JPM in January. Probably do some
Yeah.
live reporting from the ground. In both cases, in fact. So more to come.
Yes, absolutely. We will be doing those things. Yeah. I don't know. See, Vive is going to be during the winter and the long, cold winter. So we can see
The
what
long
actually
cold
happens.
winter.
When does Anthony come? We have to get Anthony on the talk show. I feel like he'd be funny.
Yeah, yeah, yeah.
Uh, yeah. He's not a
Sure,
trash talker
sure,
though.
for
So
sure.
we have to give him, we have to get someone, we have to pair him up with someone who will trash talk on the other side. So I don't know. He's
Yeah, yeah,
pretty
yeah.
nice.
He's a nice. He's a
But
very nice guy.
yeah,
Nicer
yeah,
than
yeah,
me,
yeah, yeah,
certainly.
yeah. Yeah. But anyway, Poland was great. I hung out with a lot of really cool people, and I got to know a lot of people like the mayor, Ritesh Patel,
Nice.
and obviously Grace Cordovano was there, superstar patient advocate. So Stefan, who's everywhere in the world, he was there too. But that's not unusual. So it was really good. It was a good time. Everybody should go. Everybody should go next year. We'll all go to Poland, eat pierogi, have a
Yeah.
good time.
I can't believe you
Yeah.
didn't cross the border, didn't head over to the border and take a little foot over to Ukraine, little put your toe in Ukraine. That would have
I
been
don't
good.
know. Yeah, it would have been good. But like, I was there for like 2 days. So maybe next year. I don't know. We'll see what happens. Yeah, yeah,
Great.
yeah. All right. Anyway, okay. So should we move to our special guest? Because this is just, this is just
Yeah.
us being dumb. Okay. All right. So we've got two special guests. Our first one is Alex. Ready for me to butcher your name? Meersberger?
Oh no.
German.
Ooh.
Listen,
keeping
Lisa,
a
you can
theme
say
here.
it. Yeah, listen.
Meisterschläger.
God bless Germany. God. Did
That's
you
how you
just
would
say
say
it like
it.
that? Okay. Here's Alex.
That's how
Okay,
it's
so we got our
pronounced.
first special guest.
Meisterschläger.
Well, okay, Alex, say your
In
actual last name.
German.
Or
In
is Lisa
German.
just
It's his
being
own name.
I say Meersberger, but I think even
Meersberger?
within like some parts of my family say Myersberger, or they're like, we're just
See?
grown to
See?
accept
See?
sort of whatever happens.
See,
Okay,
there you go.
whatever. Anyway, well, I have anxiety about pronouncing people's names, especially all of the
It's a fair.
yeah, because whatever. Anyway, so okay, Alex, I met along with his co-founder of the Advancement League, Antoine. When this is in my mind, how it went, I was at Vive in Miami, and I was at this dinner, and it was like my third dinner, and in my mind, I was like very glamorous, and like I took a shot, and then I took a shot of an oyster, and I high-fived him, and I walked out, and then we became best friends. In my mind, that's what happened. It might not have looked that glamorous in real life, but he's the co-founder of the Advancement League, and you're global principal of healthcare at SAS. I don't know. You should probably
Correct.
introduce yourself. I don't know.
Yeah, that was good.
I think
That was good.
I think we've done it. We got name pronunciation. So I
I was
have
correct.
day job and a night job. So day job is
and
at
night job.
SAS, the global analytics leader, and so I lead product marketing for our global healthcare community, which is a ton of fun. Which takes me actually I spoke virtually at Health Tech Forward in Poland last year. I was sad not to be able to make it. So there was someone on stage. And I was virtual, and so it was like that weird.
Oh God!
But it turned out it was a lot of fun. There.
The
Oh my
worst.
gosh, we should
that
all go.
come to
We should
Jordan.
all go.
I think we may need to go.
Perfect.
I am going to Toronto, Canada, for
Ooh.
weirdly the first time. I went to high school in Michigan, actually, so I was like right across the border. But I'm going.
How
to
did you not
Toronto
go
next
there?
Wednesday.
Like
I know,
right there.
Yeah.
Why are you going
It's
to
a bridge,
Toronto? What are you
probably.
doing? What are
I
you
don't know.
doing? What's
I'm
happening?
speaking at the 12th annual Canada Analytics Summit, which actually seems
Wow.
pretty awesome. They've pulled a really great group together. And to your point,
Nice.
I really do think that this is the first role that I've had. Every sort of role as I've traversed the healthcare ecosystem. So I worked for a very early stage startup, DoxyMe actually, which went on to become like big startup and really cool things. I randomly worked there during college. I was like paired up with the inventor of DoxyMe for a PhD project that he was working on, and they matched business students. So I got to sort of taste of early stage startup life, to hospital administrator at Geisinger, to the insurance side of Geisinger, to Blue Cross North Carolina, and then to SAS. And so each role sort of progressive responsibility from a standpoint of like small region, larger region, full state membership wise from a health plan. And then SAS, I started as an industry consultant, which was very, very focused on the US commercial market. And so most of the big payers. And so when you talked about Cigna and Humana, I also saw the rumor, though, is that true that there's like a bunch of the flight trackers saying that they're tracking Humana's corporate jets in Bentonville,
nice.
Arkansas?
I love that.
And so they're saying that either Walmart's
Yes.
going to swoop in to jack up the price,
This is a
or
good
Walmart.
rumor.
I love these
Alex.
rumors. This is what I'm here for. Yes.
All right, so
Yes.
that's hot off the press. That's my
The
my
flight
theory.
trackers,
Okay.
the tail number tracker. Yes.
Flight trackers,
Yes.
so tracked
Oh my
Humana's
God.
corporate jets
Amazing.
to Bentonville,
Amazing.
Arkansas.
Yeah.
my God.
But that tracks though, right, Alex? Because Walmart has been
Tracks.
sitting out here going like, what do we do? Watching CVS kind of falter a bit in their retail health ambitions, watching Walgreens definitely falter in their retail health ambitions. So what does Walmart do to keep that momentum going? Would make a lot of sense.
I've said when we
I'm
say
here for it.
retail, we put together sort of trends decks, just like everyone else. Sort of everyone has internal trends,
Right.
thoughts, and stuff, external, whatever. Every year we've put the rise of retail as one of those, and I think we default to think like retail actually means, in most healthcare leaders' minds, it's like Apple, Amazon,
Right.
Walmart, maybe. And I've been amazed that they've dipped their toes in the water to the extent that they haven't sort of made bigger, bolder bets, at least publicly, that we know of, on what their strategy is. And so I do think I want to be right one year in the rise of retail. And so maybe my prediction for 2024 will be like the big bet finally comes. And so Walmart buying Humana like would finally be a pretty big bet. You have one of the world's largest companies buying an insurer and like real integration. Because otherwise their clinics, I sort of make some sense and are interesting, but not like interesting enough for another competitor to be like, oh, that's interesting. So
Well, and
I'm
the reason
hoping
why
at some point they do something.
Yeah. The reason why I really like that is because Walmart, in contrast to like CVS and Walgreens or any of the other retailers in the space. Walmart is clearly in healthcare already very, very focused on price transparency and bringing down the cost as much as possible. Whereas the others are like, no, we're going to buy a PBM and just like make money on both ends. Enjoy. Like that's really like, at least
Yeah.
Walmart, for all of
Walmart
its
offers the
failings,
most
is
sort of
like,
promise for sure.
that's right. That's
Oh
right.
man,
Totally.
I love this pivot. I love how we were going from Cigna Humana antitrust to Walmart.
Yes,
I
Walmart.
love it.
Sorry, I threw that off.
Humana.
I'm into it. No, and Alex, I just want to say, if your prediction doesn't come through, remember, I've been predicting the long, cold winter since 2013. And every
So
year
I
I
got
still
time.
feel like somehow, yeah, it's no
Got
problem.
time.
It's okay. You're okay.
2025. So my
Yeah, it's
2025
it could
predictions.
2030. It could be anything. I'm not worried about it. But anyway, I cut you off.
So I was trying to answer the other story of just why I think the international market
Yeah.
is so important. It's so interesting to me. And there's obviously little pockets of it. There's like an International Hospital Federation and there's like a young emerging leaders. And so there's like very pockets of maybe 20 or 30 sort of US based hospital administrators or US based health insurance administrators that end up sort of seeing the world from a healthcare standpoint. But it is, in conversation, it is very limited of just like what any of us. So to your point of like, we focus on America. And in some ways that's great. We got American exceptionalism. You should have some patriotic pride and things. But in some ways, from a healthcare lens, we're just like, I don't know, like this is what we do and we don't care what anybody else does. And so I think it is really important, as my lens has been broadened the last few years of just learning from other people and other cultures and other aspects. That was the point of going to Canada next week. I'm really excited to just hear some more of that regulatory piece, some more of the cultural piece, some more of what they're doing. I love that quote, the great artists copy and the best artists steal. I think we're not stealing enough from other countries from a healthcare perspective, health and healthcare. We're like, oh, naps like are proven to work in Spain or other cultures, and we're like, no, we don't need naps. Like we're good.
Yeah, we don't.
Like,
We don't
there's
need any
so
naps.
much I think that we could look to and be like, that actually works and is proven, or whether it's technology, regulatory, culture, different things. I think there's some things that we should be looking outside of ourselves sort of more than we do, for sure.
No, I agree. This German insurer guy, he was telling me that because of the way their system is set up, right, they've like embraced more like digital apps, wellness apps types things that encourage healthy behaviors, and they pay for them kind of like en masse because they can. And even though they're pretty stringent, so he does go through a big data review, but just like kind of quicker to jump on that stuff. And then I spoke with two very cool people, one UK company and a gentleman, a professor from Poland, and they were talking about anti-aging solutions, right? And like how much easier it can be to commercialize in certain markets and like what the benefits are. And in the US, they have to tie it to a disease class because aging is not a disease. And, I'm like, then we have to do like big regulatory changes for some of these things, but it is really cool. And I agree, we should probably pay attention more because usually, it was eye-opening because I do love America. And I was totally into it. And I was like, oh yeah, like maybe there's some other stuff out there. I don't know, whatever. But anyway, okay. So you have a side hustle. Lisa and I have many side hustles. So we're like totally here for all that, along with your big kid job during the day, 100%. So talk to us about the Advancement League and the Young Health Leader Summit, all the things, which obviously I'm a huge fan of, but like, tell us about how that even started.
Lisa actually touched on a little bit of the thought process of like joining a startup, and you mentioned specifically like early careerists, and so you're attracted by sort of the glitz and glamour. And I think that actually works both ways. I think it works. There's glitz and glamour on the startup side of like, ooh, I'm joining this cool new thing. I'm going to be a millionaire in just a couple short years. Like that's the thought.
1.2 million.
Yeah, well, like all these stock options, they're definitely going to hit. And then there's some glitz and glamour of joining some of the big incumbents, whether it's insurer or hospital team or things. And I think we all get sucked into the main stage speeches at some of the big conferences. But I remember I was actually an employee at one of those organizations that our main leader was on the main stage. And he was saying at one point, he was like making this amazing announcement of like all the things that were happening. And I was kind of looking around the room like, wait, like none of that. Wait a minute. Like why is nobody else being like, that's
That
not
didn't
how,
happen.
that's not, yeah, I was like, that's not how it works. What is this? And so I really started to, I was really fortunate to have an administrative fellowship, which is a leadership development type program, postgraduate school for hospital administrators. And so the vantage point that you get is I reported to a direct CEO of a large major medical center. We had access to all of the president's staff meeting, but the balance of like what we saw behind the scenes and then what our lunch conversations were like and our day-to-day roles were like, there was such a gap there. And so we started hosting, just from our own lived experience, we hosted what we called healthcare road trips. And essentially we would just say like, hey, if anybody wants to come hang out at our hospital, like we're eating lunch on a Saturday morning or whatever it's going to be. And randomly people started showing up to these things. It was like us on the internet. We were like, hey, we've got...
It's like a talk show. Randomly people
like
show up to
People
our
show
talk
up.
show.
People
It's
show
like
up.
the same thing.
People show up. So
Sorry, keep going, keep going.
So eventually people started showing up in sort of droves, and we were like, now what do we do with these 50 people? Like we promised we'd pay for 8 people's lunches, not 50. Like we got to do something serious here. So we also, some of the lived experience of going to events, we just noticed sort of, especially early career young people, you're very much pushed to like the outer edge fringe of the event. It's sort of like, we're going to have our main event and then the like early career day, and your opinions and views are like the back hallway on day 5 when everyone's gone home. And we also noticed that just you pay so much as an organization to go to events, just the time away and different things. You sit around in your fancy suits, you talk about all the healthcare issues, and then you fly home. And we were all like, man, we spent like a bunch of our organization's money. We ate a bunch of good food, and like I don't think we did anything. We're like, we actually skipped the last like 8 sessions. So we said, once we started sort of putting 2 and 2 together, we said, why don't we put on our own event? And if we have a chance to do our own thing, we can do it a little bit differently. We can make sure that all sort of voices are heard. And so you get a really good mix of early stage, late stage, just different voices.
That's
we can
awesome.
sort of figure out the format there. We'll make sure just that some of that, everyone I also think has had that terrible experience on like an elevator at events with name badges, very formal, is like someone stares at your name badge and they like look awkwardly in your stomach section, and then they realize like you're not important enough.
Or worse.
Yeah, so
Or
it's
worse.
Like,
Or worse.
yeah, that's
Gonna hold it like up here. You're like, look over here.
yeah, look over here. But they stare at it and they see like your title's not high enough for them, or your organization's not cool
Right,
enough, and it's
right.
sort of
And
like,
they're like, nah,
now we're
I'm
yeah,
out.
it's like now we're stuck.
Analyst. No thanks.
Yeah. And so we said like, we're even the formality of that, if we could create an event and take away some of that formality, and so hold it in different places. Nobody has ever loved like a hotel lobby from a standpoint of like, I'm going to make best friends here.
Kat actually would beg to
Well,
differ.
that's-
I'm not sure if you
Definitely
know
make
me.
friends in the
That's
hotel
different.
lobby.
I make a lot of
different.
friends in the lobby, mostly the lobby bar, but you know, yeah. I feel you. I feel what you're saying. Yeah.
So we said like, we'll choose cool places. We'll be
Sponsored
really
by
intentional
Diet Coke.
about even name tags. So the first year we didn't do any name tags, and then that started to get unwieldy. People were like, I actually wish I knew at least that person's first name. So we did like name badges. And now we do blank name badges that you can write whatever you want, and that's been a lot of fun.
Nice.
It's actually truly inspiring to see what people write and what they're willing to give and what they are looking to receive. And then we've built it around the 24-hour community impact competition. And so every year, the last day of the event, we've actually physically given cash to groups of attendees and told them they have 24 hours to go out and do something with it that makes a healthier future. And then they come back and they tell us what you did, why it was meaningful. And so that's sort of Young Health Leader Summit born, was we had to pay for too many people's lunches and set up a full 3-day event around it. And now it's just been a magical mix of really, it's sort of misnamed now, especially because my hair is graying on the side. We actually run into Dr. Feinberg, who's now the chairman of Oracle. He was the CEO at Geisinger while we were there and when we started it. And so now that we've run into him 7 or 8 years later, he's always like, are you guys still doing that? Like, it's got to be the middle-aged summit by now.
He's like,
So
come on.
Is this the thing? And so he's been a wonderful supporter and friend and everything. But it's really an interesting mix. It's sort of 50-50 now. You have 50% sort of MHA graduate students, early careerists, early hospital administrators, early startup people, founders. And then you have 50% sort of senior level executives and all sort of recognizable names and things. And I think that's the sort of magic mix. Is just by
Nice.
calling it the Young Health Leader Summit, you automatically like self-select the good vibes only people. You've got like the best of executives who are like, ooh, I want to be around young people so I can recruit them or so I can hear new ideas or do things. And so you have a really healthy mix, I think, of people who are there of like, I want to be here and be excited to be around people.
Yeah.
Great. And I actually that's already been shared a little bit across my organization. I think we have some takers for 2024 already. So it's really exciting.
Which we're kind of upset about, actually. So the 2024 will be the 6th year. We've put like all sorts of heart and soul into our nights and weekends of how can we be thoughtful about the agenda? How can we make sure amazing people that maybe haven't had their voices heard in the past. This year, we've opened it up to international attendees. And so we have some really interesting people committed to come. We're going to do some interesting stuff with like photo booth and podcast sessions. And we were like really put in this production value here, like top
live productions.
Live.
That's right.
Health tech, you heard it here first. But people's eyes kind of gloss over at like cool speakers, cool intentional thought process, networking also. And then they hear it's in Miami and everyone's like, oh, sweet, Miami. Like, I'll be there.
I'll be there.
So, so all we need to lead with Young Health Leader Summit, Miami 2024.
Mm-hmm. Yeah. Yeah. Well, I don't think we paid our invoice yet. I did just have to slack, but Insena is sponsoring the Young Health Leaders Summit this year. Alex was so kind to invite me I had 1-day bender to Raleigh in the summer. And I was like, yeah, I didn't really know what was going to happen. Like, I was like, I'm not young, whatever. And like, I had the best time. At least I told you, I remember I called you because I was stuck in the airport till 2 a.m. And I met our new best friend, Gloria Vanderham there. And I don't know, I just like saw her across the room and I just like felt our souls connect. It was really cool. Cause I think Alex, on your website, you had something like, oh, you're going to meet your new best friend. And I really did. So
it is pretty wild though. I do think there's some, we joke sort of about just like the magic mix of people and somehow we've hit it every year, but there's some reason that it continues to happen. And so we're going to, I guess, take credit for it as much as we can. But there really is, there's a group that the first year we held the event, there was a group that connected. None of them knew each other. They're all from different backgrounds, all different parts of the healthcare ecosystem. They literally, for the last 6 years, they pick a place every 6 months and they like rent an Airbnb together and go on like spiritual friendship retreats. And so they've like traveled the world together. They've done amazing things. And so there is some of it is, I think, smaller format, comfortable setting, like all of the things that I think we try.
No pretenders.
Yeah, it attracts the good vibes only crowd. And so for good vibes only, and as long as Gloria says yes to anything, I think you're in good company. And so
yeah. I thought it was great. Gloria's a bellwether for the good times, I think, for sure. But yeah, it's a good crowd too. Like I see it's like kind of the same fun crowd that travels around. And I think the fact that you've designed it to give access to people is really, really cool. So nicely done. And then the Advancement League in general, I actually don't know too much about that. It's the parent organization of the conference, right?
Correct. We actually, I don't know if you've ever seen the movie Accepted.
No.
They create a fake college. I think what's Ryan Gosling's wife's name?
Blake. Is that Blake Lively?
Blake Lively. I think it's like young Blake Lively.
No. I think Melissa's shaking her head at us that we're dumb.
Melissa,
probably.
You got to type it in. Or you got to just yell it over. She's figuring it out for us. Oh, Reese Witherspoon?
I think you were.
That's not true.
I think you were right.
We are
on
right.
Melissa,
definitely
Eva Mendes. Tune in for the win. For the win.
Maybe it's not Ryan Gosling. I think I messed that up. I actually screwed that. I'm pretty sure actually it is Blake Lively. So
Ryan Reynolds.
Ryan Reynolds.
I know. Oh no. Ryan Gosling. Ryan Reynolds.
All right. Anyway, the point is we got this figured out.
All right, I screwed all of this up. But the point is, it's a popular movie. They create a college. Like the kid doesn't get accepted. The whole thought of the movie is the kid doesn't get accepted into college, so he needs to fake out his parents. So he creates this acceptance letter to this fake college. But they make the button clickable. And so all of these people start enrolling and sending checks to this fake college. And he's like, shoot, now I got to have a college. The Advancement League, the thought process behind it was the sort of main event is the Young Health Leader Summit. We did some more sort of pop-up events throughout the year. And then there was a lot of demand for sort of how do you connect people between these events? And so we thought sort of quasi-professional association, how do we capture some of that energy, magic, and impact opportunity from a Young Health Leader Summit, and how do you create sort of a quasi-professional association around it? And so we actually created membership And in a stroke of luck or genius or bad luck, we made it clickable. And like within a day, we had like 100 paying members. And the very first person, and we've attracted mostly like first 5 years of your career, like fresh out of MHA programs, trying to find your way. We've got some good connections. People like our resources and thoughts. The very first person that paid us is like a LinkedIn top voice, famous orthopedic surgeon from Boston. And we literally called him and we were like, I guess we can like give you your money back. Like, I don't know what we're going to do for you. And so we were very fortunate. We learned a lot. We did about a year of membership, and then we have pivoted to just focus on the event for now. In 2025, we're going to come back out with, we've got some real thoughts and real traction behind kind of certificate type programs, different ways of networking and fostering collaboration, and some different things for startups that we have. So I think there's more to come from a 2025 perspective. 2024 is all about Miami in May. But more
I really like how you're like you're anchoring it on a 2006 movie with Blake Lively. I just confirmed as your like thesis of like we just like put up a website, made the button clickable, and then people said yes, which is incredible. And you are very well suited to startup life.
And we know that it's more than that, Alex. But also, Anthony Leon says the institute or the college that was created is South Harmon Institute of Technology or something.
So that's
I haven't seen that movie. I'm into it. Well, all right. Okay. Well, this has been this has been enlightening. We've gone from, all kinds of things, including, you heard it first here, Walmart's buying Humana based on the tail fin watchers. Yeah. The tail tracking. So yeah, Alex, what else? Any parting words? We have to kick you out to get our next special guest on the board here.
Parting words. I think I think two things. One is just we all owe it to your point of just, and I have a t-shirt that says Healthcare Optimist, actually. We have hats too. We give them out at the Young Health Leaders Summit. But when we started this, I heard both of you talking about just the challenging economic times and layoffs and different things. I think this year and every year, platform-wise, we just owe it so much. The world has changed so much from an economic perspective of just housing and lifestyle costs and different things, that giving advice to an early careerist, even 3 or 4 years behind me, is like, it's not the same world. It's not the same advice. It's not the same pathway and different things. And so my parting ask is, from a support for the Young Health Leaders Summit, whether you can be there in Miami or not, just find a way to be helpful and present and excited about the people coming after us. Some of them may create the companies and the categories that really improve our health and that make a difference. Some of them may be hiring us in a few years. I think we all I hope so. Some of these
hiring me probably.
So we all have some of these like limiting perspectives of like, oh, they haven't paid their dues, or they haven't done this, or they haven't done that, or whatever it is. And so my just ask is if we can all support the people who are just graduating, just thinking about school, coming out, struggling with figuring out what to do next in their career. I think we owe it to the future of health and the future of our world to do that. And so that's my ask.
Oh, that was good. That was good.
I'd vote for you.
All right.
That's great.
Yeah, vote for Alex. Vote for Alex. All right, here's our transitional slide. Here's our friend Gloria. This is all her good vibes going on here. Oh my gosh, so good. All right, and now we have Lisa. You should introduce our next special guest.
Shruti Kothari. Hi.
Hi, everybody. Happy Friday. I know Alex.
What a celebrity.
Alex, I can't see you on camera anymore, but Alex and I
You spoke at the Young Health Leaders Summit, right?
We're supposed to, and then
that's a sad memory. That's a hard.
I know you're bringing.
She's going to speak at 2024's. Do you hear that here? Can we announce that here first?
Yeah, we heard. You heard it here first. So many hot takes.
I will be in Miami. All
right, we're in.
Okay, she's going to be there. Got it.
We're all going to be there. We're all going.
Tell us about yourself.
Introduce yourself.
Oh, yes. Okay. My name is Shruti Kothari. I call myself an innovation advocate, healthcare innovation advocate. Like, what is there? I feel like it's so funny. I love this show because it's like I didn't even prepare for
That's
my
right.
bio because I was like, oh,
No,
great.
there's no
That's
prepare.
right.
No prepare. You
We're
just
gonna
go. You just go. Do it live.
right?
Don't
So
prepare.
I lead industry initiatives at Blue Shield of California, where we're working to scale innovation through the lens of healthcare super fragmented. So oftentimes when we want to scale innovation, innovative ideas, so whether it's technology or concepts like value-based payment models, things like that, you have to actually have supportive policies, right? It's one of the most regulated industries that there is out there. But on top of that, you have to create industry alignment as well, because oftentimes the players involved have misaligned incentives and they're not on the same page about things. And so our team focuses on core innovative things that we're trying to do and aligning industry players who might typically be our competitors, like, for example, other health plans. Or it could be actually passing progressive legislation that supports our innovation agenda. And my way of getting here, though, is the reason I landed here. I work with a lot of policy wonks. I am not a policy wonk. Even though I did study health policy, I came from quality improvement to working at early stage startup at Honor. For folks that know Honor, I was like employee number 7 at Honor, to venture capital, worked for Kaiser Permanente's venture capital fund.
That's where we met.
That's where we met. Yes, that's right. Who Chris Klopp, by the way, still remains one of my favorite people. Like, he's like just genuinely the nicest human ever. And so,
Yeah. Chris and I are good friends. It was the best of times and it was the worst of times. That's how it was. Yeah. No. We are very good friends. We hang out often. I'm glad to hear that he's on your favorite person list.
yes. I mean, maybe it was the times, but it was, yes. And so anyways, saying this to say, like, worked in a lot of different sectors, from operations to VC to startup, to know that these are things that really are barriers to innovation scale. And the last thing I want to mention is I'm also the founder of an organization called Women of Community, which is working to, it's a play on women of color, women of community, WOC. But McKinsey does an annual report on women in healthcare, and it found that only 4% women of color are senior leaders in healthcare, which is really egregious when you think of the amount of frontline staff, both clinical and not, caregivers, paid or family, and disparities in health that are related to women of color, and why we don't have more women of color in leadership positions as a result. So the organization is now about 3 years old, and we have, I think, over 7,000 in our community now. And we just do different things like events and advocacy campaigns. So you should check us out. So that's my,
That is
definitely.
totally awesome. So you have your real job and your side hustle too.
yes, I do. I really do.
Look at all these people with their side hustle.
Oh my gosh. Look it.
Early in career, I got that advice from a very senior leader at Kaiser. He was like reported to the CEO of Kaiser, Bernard Tyson at the time, and George Halverson before that. But he told me, he took it upon himself to mentor me. And I was right out of grad school, and he told me a few things that were really great, piggybacking off of Alex's young, if there's any young leaders out there. One, he said, never have your whole identity be the corporation you work for, because as long as you are not helpful to people, they won't see you that way anymore. And so a lot of people make that mistake. And also, you never know with change of leadership when you're disposable, essentially. It's a cynical way, but it's true to look at it. The other thing is, he said, at a large organization, there's always something a little Machiavellian about somebody who makes it to a really extreme executive.
Oh,
I know. I thought that was a really interesting comment. And he said, you have to decide whether you want to play that
political.
game. Exactly. You have to decide whether you want to play that game and have that long shot, but then also remember, don't make your whole identity your organization. So.
Yeah. Love it.
That's
have many
really
businesses. That's what that's my takeaway. Just have as many as possible. And wrap your identity up in that. That sounds fantastic. So we did get a comment, and we'll put this in our recap. But Mayor of Warsaw, Poland, has asked how they find out more about your Women of Color organization.
Oh, we are gonna post all about it, but tell us what else, Shruti.
Well, you
We'll
can
put it
follow
all.
us on LinkedIn.
Yeah.
It's Women of Community. Actually, you know what? Am I able to put it in the chat or no?
Only there's LinkedIn chat and it's a little bit of a mess.
Okay.
Yes, sort of, but not really.
You can put it in our chat. No one else will see it. But just we'll post it tomorrow. Yeah, we'll post it on the recap. Yeah.
You can follow us on LinkedIn, Instagram. You'll see the posting with the links for it. We also have a quarterly newsletter that goes out about different events we're doing, virtual and in person as well. So you should subscribe to our newsletter, which you can do through our website, womenofcommunity.com.
Yeah, awesome. Well, what I wanted to give you praise for so many reasons, but one of them for sure is that I think that the industry initiatives work is really unique. And, Blue Shield of California, like very dynamic payer organization, not all positive to everyone, but very dynamic, I would say, and doing interesting things, and definitely having like a position, right? Being very like position forward, very advocacy forward, which I really appreciate because I think it's important to take a stand. And creating industry initiatives is really a sign of showing like we're willing to go outside of our comfort zone and potentially partner with kind of technically competitors to do important stuff. Can you talk more about the industry initiatives sort of general idea, like what you guys are doing? I think it's really unique and special.
Yeah. And we partner with Lisa too. I love it, on our data sharing work, which has been amazing. So the concept was born out of, we have a whole health reimagine agenda. Any big healthcare organization usually has some kind of large innovation agenda where they will test and pilot things, whether that's in collaboration with startup companies, technology companies, or it's just innovative ideas that they're trying to test out, right? And I think we've all heard of like the deathbed of like piloting to death, right? Like where it's like, great, all this money spent, and then it doesn't scale and it goes nowhere, right? And I know people who've worked on the startup end like really feel the burn of that, because you're hoping for a scalable partnership when you put up these resources, right, for a pilot. And what oftentimes is the case here for why it is unable to move is because there's either active policies blocking scaling of this innovation, or there are industry players who are not aligned that prevent the scaling. So I'll give you kind of like an example of that. So policy, for example, like Lisa and I work together for our data sharing priority area. When we think about any innovative company and what they're trying to do, data sharing is like foundational, like key, right? The state of California does not have a mandate for data sharing. Some other states do, like North Carolina, for example, Nebraska, and they've been able to really leverage the HIE infrastructure for data sharing during the pandemic and have really good outcomes and so on. Reason in California, like for over 20 years, people have been trying to pass legislation that supports data sharing. But there, again, are so many misaligned incentives and people on different sides of the court campaigning for different things. So when industry initiatives, we took that on as a topic area, it was like, all right, well, we need all of the people at the table, the people who are our competitors, the people who are blocking it. We needed to come to some sort of an agreement to try to actually pass some sort of legislation. And so, while what I'm saying sounds simple in nature, it's absolutely not. Like in terms of like when in the beginning when we started, right? Like when we started doing this work, like we had to start in NDAs with other health plans to even have an informational meeting with them. And like our legal teams had reviewed those NDAs. And it was just like not even talking about any work. It was just baseline informational conversations. And it was really a glimpse into our ecosystem and how like fragmented it really is. So sitting on the inside, I'm telling that to anyone who's on the line who's like an outsider that's like, why can't we just make this move? It seems simple enough, right? Like it's so much more complicated, yes, by the regulations and all that, but also in the ways in which we've developed our ecosystem and how we engaged with care. So we are trying to, in industry initiatives, to break that down by actually moving real topics that can make impactful change. So data sharing is one of them I mentioned. And we did get legislation passed, by the way, in 2021, Lisa, right?
I think so. Yeah.
Yeah, and we continue to work on kind of amendments and making it operational within the state of California. Payment models is another one, value-based payment models in primary care. That is a huge win because so many people talk about that, but actually Blue Shield of California was the only one testing value-based payment models in primary care specifically because the use case there is like just huge. And
Really?
yes, we were
The only one.
only one. Like lots of talk around it, but in California specifically.
In California.
Yeah. California's not small though. It's like Canada. So
No, it's huge.
It's not.
I'm
I think it's bigger,
surprised.
or maybe bigger than Canada.
It might be
there's also just like
population wise, it's like
yeah.
pretty close.
The structure is very unique in California because there are a lot of IPAs, physician groups, associations who run a lot of the payment at the county level, more or less. So it's a very unique. It has a bunch of really unique features but what Shruti is saying is actually true. That's the problem, is that it's very complex and functions in its own way. And yeah, lots of talk, and
lots of
we're
talk.
waiting to see the action.
Yeah.
Lots of talk. People
And
talk, big talk.
No action.
Exactly.
Big
We
talk,
had
no action.
amazing outcomes with when we piloted and tested these value-based payment models. Everyone was happy. Like patients and families were happy, providers were happy, we were happy as a health plan. The challenge is we are like 20% of a large provider group like UCSF, for example's contracts. So for them to be able to change their internal systems to really go to value-based, it can't just be Blue Shield of California. It's got to be all the health plans, or the majority of health plans they contract with, right? So this was the work that we took on in payment. And that's the example of kind of aligning industry. So there wasn't a policy necessarily attached to it, but the first step is to get all the players on the same page, and then we can introduce policy. I'm happy to report with that. We in 2022, we got 6 major health plans, including us, to agree to the same value-based payment models in primary care. And this next year will be our like implementation year, which is cool. Yeah.
That's really
Very cool. Very awesome.
Yeah. This is, by the way, if there are any government people listening, here's what you could do to be helpful. And this is not Shruti asking, this is me asking, or me telling you, me giving you advice. I do not represent a payer or a plan. You should create safe harbors for payers and plans to do work together on topics that are really critical of national importance, like value-based care, like data sharing, whatever. Like you can specifically say, hey, work together. Don't be worried about getting in trouble from us. We'll be at the table too. That's what they could do. That's my advice, not Blue Shield.
God bless our regulators.
Just saying.
Yeah.
I advise you.
Well, so Shruti, you just wrote this article that I so well screen captured here on MedCity about innovation and things like that. So I wanted to make sure we got to that, and you were able to cut through any other pieces. It sounds like you've been talking about that the whole time. But any like big takeaways? By the way, great article, nicely done.
Thank you.
Very good.
That. You know, like it's a lot of it is what things we're already talking about. And this specific article is geared to the innovation ecosystem. If you're specifically someone who's trying to work with health plans, you know, as a vendor. And I can't I think this is like obvious a little bit, but like I can't hammer it enough with know the operation side, because I think we think about that a lot with integration and care experience on the provider side, and hospitals and things like that, but not as much necessarily on the health plan side. I think we often think of health plans as the payers of things, and this obviously makes sense for the consumer, the patients and families. So like, why wouldn't we do that? But health plans have just as much regulations as hospitals and provider groups and things like that. So knowing kind of what are again, I'll give you another example. There was a company that we were working with and that works with other folks that does text-based messaging in different languages. And it was an incredible company. The challenge is there's federal regulation that prevents text messaging, right, to Medicaid populations. And this specific company was really targeting that sort of patient population. So past a pilot stage, there's a huge federal policy that's preventing this from scaling in really the meaningful ways. So I say this because you really got to know these different things that are happening. And so on the operation side, know what's going on in relation to your company, with operations. I also think there's so many wonderful companies and innovative things happening, but oftentimes people can feel like their one thing is like the biggest thing, and of course it is a really important thing, but when you look at everything that you have to consider and what budget you may or may not have, like it's really looking at like, where do you fit in this organization, like as they know what their top priorities are. Like all of that information is basically published like online to the public. Know what
Right.
top priorities are saying, know what they're already spending money on and where you fit into that. And I talked about co-optation with other health plans to move some of our priority areas, but you should also be thinking about co-optation within your own industries, other competitors even. But it's like, I think so often when you approach a health plan as an innovative company, it's like this very specific, like we're the best thing, like just like look at us, like it's this pre-packaged messaging. But if you're really trying to land a scalable thing with a health plan, it's sort of doing your research on this. And so the article talks about some of these areas, and that's kind of like the high level of all of it, I would say.
Nice.
Yeah, I'm into that. I love the advice on learning the workflow, like learning how these organizations actually work. I always tell startups, do not make your prospect do your thinking for you. Like, don't walk in and be like, here's my thing, it's amazing, and then make them walk through how to make it fit. Like,
Right.
do the thinking for them, right? And that'll be better for everybody. But man, so many of them do just come in and like throw the PowerPoint.
It's so many. And it's like, because they are focused on really important topics, like having worked at a startup and literally have been like a door-to-door salesperson at skilled nursing facilities, I get it. But like, at the end of the day, I mean, this is a real story. When I worked at Honor, I was, again, like employee number 7. I was brought in to help design the care products and the tech product and work with the engineering team on that. And they hired a great business development person who had a great track history of like, but they couldn't get a single client. And so it became really dire where we had all of our caregivers set up, like had established all those processes. We had no clients. And everyone became like trying to sell. And everyone kept, because mostly people were coming from the tech industry, everyone kept talking about the beautiful experience of technology and everything, like, which nobody cared about. And then I literally would show up like during break time with donuts and like give out coupons to say like, we'll be your cheapest option. Like, cause I know that's what's, front in mind for you guys.
Right.
Like,
Right. What are the pain points? Yeah. Yeah.
We got our first clients as a result. But like, that's me knowing healthcare. That's me knowing how social workers at skilled nursing facilities work, having come from quality and the continuum of care at Kaiser. Like, I knew the background. I knew how that worked. So I was able to. You don't have to have that background. Just do your research so you can show up.
Right. Right. Do your research before you try and sell your wellness app to any payer or plan, please. That's
right.
what I ask.
Well, and understand your buyer, right? Understand your user and your buyer,
Right.
and they're different usually. And I think that's what you're saying, Shruti. You were able to understand what was going to resonate with them, and also that like maybe they want a donut once in a while.
Honestly, like
who among us?
You win more flies with like honey than with vinegar or whatever. But
yeah.
Like, this is actual honey. It's donuts. It's sweet.
Absolutely. 100%. Yes.
I support a donut-based sales process, and I also would just like to put that out there to anyone who cares. I'm definitely open to donuts. So, I won't buy anything, but I am open to donuts.
Awesome.
As you know.
Awesome. Well, we are almost out of time as usual. Our non-planning has resulted in us being right up to the line. But Shruti, any parting words for us? So awesome to have you on the show and hear about all the cool things you're doing these days.
I just find everything so fascinating. Like, I feel like staying hungry, staying curious. I feel like I've worked at very large organizations like a Kaiser, like a, Blue Shield. I've also worked at smaller companies. And I just feel like in healthcare, it's very easy to get really disgruntled, I think, just because of how hard everything can seem sometimes, especially in the innovation universe. And I will say that, like, I just think it's cool. Like, I think of like how digital health has blown up. Like before the pandemic, there was like, I think like a pretty like distinct crew of people who were known in digital health, right? And convenience. Like, that was it. Post like during the pandemic, so many new entrants into the like I go at networking. I used to go to networking events and know like everybody, right? Now I go to networking events and I know like maybe 2 people in a sea of like 200, which I just find so exciting, right? Because it's like this new host of characters and things. So I think some people are complaining about some of those things in terms of people coming in who don't have the history of healthcare and all the different things. But I mean, like, as Alex was saying, like age, like it's not a factor. Like Mark Zuckerberg made Facebook when he was like literally like what, 18 years old. Like, so meaning you don't have to have the experience as long as you're somebody who has the humility to understand healthcare and the players involved. I think that's all that matters. And I think that healthcare is very exciting. Like it's an exciting place to be because there are so many opportunities and different things. And when we think about health, so many things fit into it. So you can have like 9 lives as a career in healthcare. So my parting words are just that. Like, I think if you work in healthcare, it's such an exciting place to be, and don't turn to the dark side and get disgruntled.
Don't burn out.
Don't burn out.
Get disgruntled. Don't turn to
Don't
the dark
get mad.
side. I like that one.
Yeah.
Be like,
Yeah. But
Nice.
if you do just get disgruntled, just start a new business. Just keep going. Just start more things. Just do stuff. It's
Take
no
a
problem.
vacation and actually unplug.
Start a talk show.
Start a talk show.
All kinds.
Exactly.
So many things you
Nice.
can do. Something. Well, thank you for joining us. It was awesome to hear about what you're up to. And, we are super fans over here. So, just let us know when you want to hang out in Miami at Alex's conference. We'll be there.
We're in.
We'll be there. We'll be on the beach sipping some mojitos. Yes.
We'll see. We'll find out.
Something's going to happen. Something's going to happen. All right. Well, it's the end of the Health Tech Talk Show. Here we are. We're going back to some other placeholder image here, but thank you all very much for joining us and tolerating our whatever we're doing. Okay. All right. Goodbye. Good night. Happy weekend.
Goodbye. Good night. Good weekend. See you later.